Your doctor checks your blood pressure at 2 in the afternoon and says the number looks fine. But you wake up every morning with a dull heaviness in your chest, a pressure behind your eyes, and a tiredness that coffee cannot fix. And you wonder, if everything is fine, why does my body feel like this every single morning? Here is what nobody told you. Your blood pressure is not one number. It is a moving target. And the reason your mornings feel the way they do may have nothing to do with your medication, your diet, or your age. It may have everything to do with 7 specific minerals, and the fact that most people over 60 are running critically low on all 7 without knowing it. I'm going to show you exactly what these minerals are, exactly how they work inside your blood vessels, and exactly how to add them to the water you already drink every day. 1 pinch, 1 glass. And within days, your body starts regulating pressure from the inside instead of just being managed from the outside. One important note before we begin. I am a doctor, but I am not your doctor. Everything in this video is for educational purposes. Do not stop or adjust your medication without speaking to the physician who prescribed it. Use what you learn here to have a smarter, more informed conversation with your doctor. That conversation may change everything. Let me tell you about a woman named Ruth. Ruth was 71 years old, a retired school teacher from a small town in Ohio. She had spent 40 years teaching 3rd grade, coloring worksheets, reading aloud, tying shoes. Her hands were steady, her mind was sharp, and she had never in her life sat still for very long. After retirement, she took up gardening. Tomatoes, peppers, basil. Her backyard became her classroom, and she tended it with the same patience she had given to 30 years of 8-year-olds. Ruth had high blood pressure. She took her medication every morning without fail. Her doctor told her the numbers looked good, but Ruth did not feel good. She woke up stiff. Her fingers felt tight around her coffee mug. By mid-morning, she felt better, but the first 2 hours of every day were a battle. She mentioned it to her doctor. He said it was probably just age. She mentioned it again 6 months later. He adjusted her medication slightly. Nothing changed. Ruth started spending her mornings inside, sitting in her chair, waiting for her body to catch up to the day. The garden was still there, but she was watching it through the kitchen window instead of kneeling in the dirt. Her granddaughter, who was studying nutrition at the time, asked her one Sunday afternoon what she drank in the morning before her coffee. Ruth said, "Nothing, just the pill." Her granddaughter asked to look at her last blood panel. Magnesium, below the lower range. Potassium, borderline low. No one had ever connected those numbers to her morning symptoms. That is the conversation we are going to have today. Because Ruth's story is not unusual. It is remarkably common. And the solution is not a new prescription. It is minerals. The same ones your body has always needed. Just the ones that quietly disappear as we get older and are almost never replenished. Let us begin. Before we name the 7 minerals, you need to understand one thing. As we age, the rules change. The kidneys become less efficient at retaining key minerals. Medications, especially diuretics, ACE inhibitors, and some beta blockers, accelerate that loss. A diet of processed food provides almost no mineral replenishment, and the body's ability to absorb minerals from food and supplements decreases with every decade after 60. Think of your body as a bucket that has developed small holes at the bottom. Every day, minerals are leaking out. Food fills the bucket partially. But if you are on medications, eating processed food, and absorbing less efficiently, the bucket is always running low. Low mineral levels do not cause pain. They do not announce themselves. They create a background pressure, a low-grade tension inside your blood vessels that makes everything feel harder than it should. The vessel walls stiffen slightly. The signals that tell them to relax become weaker. Blood moves through them with more resistance. The number on the monitor creeps up, or stays up, even when everything else looks fine. That is the biology behind Ruth's mornings. And that is the biology we are going to fix, 1 mineral at a time. Potassium is the most important mineral for blood pressure regulation. I want you to understand exactly why, because once you see the mechanism, you will never ignore it again. Sodium is what drives blood pressure up. It pulls water into the bloodstream, increases blood volume, and forces the heart to push harder. Potassium is sodium's direct counterbalance. It signals the kidneys to release sodium through the urine. When potassium levels are high, sodium leaves the body. Blood volume drops, pressure drops, the whole system decompresses. In societies that eat large amounts of fruits, vegetables, and unprocessed foods naturally high in potassium, hypertension affects only 1% of the population. In industrialized countries where processed food is the norm and potassium intake has collapsed, 1 in 3 adults has hypertension. That statistic is not a coincidence, it is a mineral equation. In the Rotterdam Study, which tracked older adults over years, an increase in potassium intake of just 1 gram per day was associated with a 0.9 millimeter of mercury lower systolic pressure and a 0.8 millimeter lower diastolic pressure. Small numbers, but sustained every day, they matter enormously for long-term cardiovascular risk. Potassium also works inside the vessel wall directly. It helps regulate how smooth muscle cells in the artery wall contract and relax. When potassium is low, these cells stay in a semi-contracted state, keeping the vessel narrower than it should be. When potassium is adequate, vessels relax. Blood flows with less resistance. The heart does less work. How do you add it to your water? A quarter teaspoon of cream of tartar, not baking powder, cream of tartar specifically, dissolved in a full glass of water provides approximately 495 milligrams of potassium. This is a traditional mineral supplement, and it dissolves completely. You can also use a small amount of light salt, which contains potassium chloride, in your water. Either method delivers potassium in an absorbable ionic form that your body can use immediately. Important caution: if you have chronic kidney disease or take potassium-sparing diuretics, do not add supplemental potassium without consulting your doctor first. High potassium in compromised kidneys can become dangerous. There is a class of blood pressure medications called calcium channel blockers. Your doctor may have prescribed you one. These drugs work by blocking calcium from entering the smooth muscle cells of blood vessel walls. Because when calcium floods into those cells, the vessels contract and pressure rises. Magnesium does exactly the same thing, naturally, without a prescription. Magnesium sits at the gate of the calcium channel. When magnesium levels are adequate, it physically blocks excessive calcium entry into vessel wall cells. The vessels stay relaxed. Blood moves through them freely. Pressure stays down. When magnesium is low, which it is in the majority of adults over 65, that gate is unmanned. Calcium floods the vessel cells. They contract. The vessels narrow. Pressure rises. This is not a theory. It is the established biochemical mechanism behind why magnesium deficiency is so closely linked to hypertension. A clinical study published in 2004 found that subjects with borderline hypertension who consumed magnesium-enriched mineral water for 4 weeks showed a significant decrease in blood pressure, with the greatest effect in those who had the lowest initial magnesium levels. The mechanism was clear. Replenishing magnesium gave the body back its natural pressure control tool. The Rotterdam Study found that an increase of 100 milligrams of magnesium per day was associated with a 1.2 millimeter reduction in systolic pressure and 1.1 millimeter reduction in diastolic pressure in older adults. To add magnesium to your water, use magnesium bicarbonate or food-grade magnesium chloride flakes. You can make magnesium bicarbonate water at home by adding half a teaspoon of unflavored milk of magnesia to 1 liter of cold, carbonated water, shaking, and allowing it to settle. The carbon dioxide reacts with the magnesium hydroxide to create magnesium bicarbonate, one of the most bioavailable forms of the mineral that exists. Most people think of calcium for bones, but inside your blood vessels, calcium plays a precise structural role. It helps stabilize the vessel wall itself and supports the electrical signaling that coordinates heart rhythm and vascular tone. Here is what most people do not know. The relationship between calcium and blood pressure is a balanced story. Calcium inside vessel cells causes contraction, but calcium in the blood at the right concentration actually supports proper vessel function. When dietary calcium is chronically low, the body releases a hormone called parathyroid hormone to pull calcium from bones into the blood. This hormonal response also, as a side effect, drives up blood pressure. The DASH diet, the most scientifically validated diet for blood pressure reduction ever studied, is high in dairy, leafy greens, and other calcium sources. Participants in DASH trials saw systolic pressure drop by an average of 11 millimeters of mercury on the full diet. While potassium and magnesium contributed, adequate calcium was an essential part of that outcome. Research specifically in hypertensive women showed an inverse association between calcium intake and diastolic blood pressure. The protective effect may be modest on its own, but combined with potassium and magnesium, it becomes part of a coherent whole. Adding calcium to your water. A small pinch of food-grade calcium carbonate powder dissolves in water with a slightly chalky taste. A better option is to drink a glass of water alongside calcium-rich food. Half a cup of plain yogurt, a small piece of hard cheese, or a handful of almonds, so that the water carries the minerals you are eating into your system together. Wait, sodium raises blood pressure. That is what you were told. And at high doses, that is true. But here is what the research actually shows, and it will change how you think about salt entirely. Sodium is not the enemy. Sodium imbalance is the enemy. Your body requires sodium to maintain fluid volume, nerve signaling, and blood pressure itself. Without any sodium, blood pressure collapses. This is the mechanism behind dangerous low blood pressure episodes in seniors who restrict salt too aggressively. The problem is not sodium in isolation. The problem is the sodium to potassium ratio. In primitive diets with high fruit and vegetable intake, the ratio of potassium to sodium was approximately 5-1 in favor of potassium. In the modern Western diet, that ratio has completely inverted. Americans now consume double the recommended sodium and about half the potassium. When the ratio is right, the body handles sodium effortlessly. The kidneys excrete the excess, potassium keeps the balance, and blood pressure stays calm. The key insight here is this: do not just reduce sodium, actively increase potassium. A study of 34 randomized trials found that reducing salt intake lowered systolic pressure by an average of 4.2 millimeters and diastolic by 2.1 millimeters. That is meaningful. But in the same body of research, populations that raised potassium while reducing sodium saw far greater and more sustained benefits than those who reduced sodium alone. For your water practice, use a mineral salt blend. There are products on the market that combine sodium chloride with potassium chloride, reducing your sodium intake while simultaneously raising your potassium. One small pinch of this blend in a glass of water corrects both sides of the equation at once. Phosphorus rarely appears in blood pressure discussions. That is a mistake. Phosphorus works alongside calcium in a tightly regulated system managed by the kidneys. When phosphorus is too high, as it becomes in people who eat large amounts of processed food, which is loaded with phosphate additives, it suppresses the activation of vitamin D, which in turn reduces calcium absorption, which triggers the parathyroid response that drives blood pressure up. In people with healthy kidney function and adequate phosphorus balance, the system runs quietly. But in seniors with even mildly reduced kidney function, which is common and often undetected, phosphorus regulation becomes impaired. The downstream effect is higher blood pressure, stiffer vessel walls, and reduced cardiovascular resilience. Phosphorus is not something you add to your water. It is something you manage by what you remove. Reducing phosphate additives, which are found in cola drinks, processed meats, fast food, and packaged baked goods, allows the rest of the mineral system to work properly. The water you drink does the cleansing. The minerals you add to it restore the balance. Phosphorus does its job properly only when the rest of the system is not overwhelmed. The endothelium. This word is going to be important. It is the thin, single-cell thick lining of every blood vessel in your body. The endothelium is not just a passive wall. It is an active organ. It produces nitric oxide, the molecule that signals blood vessels to relax and widen. It regulates clotting, inflammation, and vessel tone second by second all day long. When the endothelium is healthy, your blood vessels are flexible, responsive, and self-regulating. When the endothelium is damaged by chronic inflammation, oxidative stress, or nutrient deficiency, the vessels lose that flexibility. They stiffen, they narrow. They cannot respond to the moment-to-moment demands of the body. Zinc is one of the primary nutrients that protects the endothelium from oxidative damage. It is required for the production of antioxidant enzymes that neutralize free radicals before they damage vessel wall cells. Research has shown that zinc deficiency is associated with higher blood pressure, increased endothelial inflammation, and reduced nitric oxide availability. Older adults absorb zinc significantly less efficiently than younger people. Zinc also competes with copper and iron for absorption, and many seniors are on multiple supplements that inadvertently block zinc uptake. A small pinch of zinc-rich mineral salt dissolved in your morning water, or a zinc-containing electrolyte blend, provides enough supplemental zinc to support endothelial protection without the risk of excess. Alternatively, eating a handful of pumpkin seeds each morning alongside your mineral water achieves the same effect through a whole food source. Of all 7 minerals, silica is the one most doctors have never mentioned to their patients. It does not appear in standard blood panels. It is not measured in routine nutritional assessments. And yet the science behind it for cardiovascular health in older adults is quietly remarkable. Silica, also called silicon dioxide, is the primary structural mineral in arterial walls. It maintains the elasticity and integrity of the elastic fibers in blood vessels, the fibers that allow arteries to expand with each heartbeat and recoil between beats. When these fibers are maintained, blood pressure rises and falls smoothly with each pulse. When they degrade, which happens progressively after the age of 30 and accelerates after 60, arteries stiffen. That stiffening is one of the primary reasons isolated systolic hypertension is so common in older adults. Research on populations with naturally high silica in their drinking water has found lower rates of cardiovascular disease and better arterial elasticity compared to populations drinking soft, mineral-poor water. A 2019 review confirmed that electrolyte and mineral composition of drinking water has measurable effects on cardiovascular outcomes. The most elegant way to add silica to your water is through food-grade diatomaceous earth, a fine white powder derived from the fossilized shells of microscopic algae. 1 teaspoon in a large glass of water is the traditional delivery method. It has no taste. It dissolves into suspension. It passes through the body, providing its silica content to the tissues that need it most, including the arterial wall. You can also drink naturally silica-rich mineral waters, such as Fiji water, which contains approximately 85 milligrams of silica per liter, higher than virtually any other commercially available water. Here's how you put all 7 minerals together into a single morning practice. Start with a full glass of room temperature water, 12 to 16 ounces. Room temperature matters because cold water causes slight vessel constriction before absorption. Room temperature allows immediate, easy absorption. Add to that glass a small pinch of mineral blend salt containing both sodium chloride and potassium chloride. This covers minerals 1 and 4, potassium and the sodium balance. 1 teaspoon of magnesium bicarbonate water concentrate, which you have prepared the night before using the milk of magnesia method described earlier. This covers mineral 2. A small squeeze of fresh lemon. Lemon does 2 things. It adds trace minerals and vitamin C, which supports collagen production in vessel walls. And it slightly acidifies the water, which improves the absorption of magnesium and calcium from whatever you eat alongside the glass. If you use a natural mineral water as your base rather than tap water, choose one with confirmed high mineral content. Look for total dissolved solids above 500 milligrams per liter on the label. This alone provides meaningful amounts of calcium, magnesium, and silica without any additions. Alongside this glass, eat something that provides calcium: yogurt, a small wedge of cheese, a handful of almonds. The whole protocol takes under 3 minutes. The minerals are in your bloodstream within 20 minutes. By the time the first blood pressure peak of the morning arrives, typically between 6 and 10 a.m., when stress hormones flood the system and vessels clamp down, your vessel walls are already bathed in the minerals they need to respond flexibly instead of rigidly. This is not a cure. Let me say that clearly. If you have hypertension and you are on medication, these minerals support your medication. They fill the gaps your diet has left open. They give your endothelium the raw materials it needs to do its job. But your medication is managing a mechanism that took years to develop. Minerals replenish the system. The medication manages the acute risk. Both are part of the picture. Ruth's granddaughter put together a simple mineral plan for her. Morning water with magnesium concentrate, a mineral salt blend, lemon, and a small bowl of plain yogurt. That was it. No new prescriptions. No significant diet overhaul. Just minerals, replaced in the water she was already drinking. Within 2 weeks, Ruth started waking up without the stiffness in her fingers. The pressure behind her eyes in the morning was lighter. By week 3, she was back in the garden before 8 a.m. Not because everything was solved, but because the background noise that had been running in her body every morning had turned down. At her next appointment, her doctor noticed her blood pressure readings were more stable across the day, not just at the afternoon appointment. He asked what she had changed. She showed him the mineral protocol. He looked it over, said the potassium and magnesium additions made clinical sense, and asked her to keep tracking her home readings. Ruth's chart is not a dramatic transformation story. It is something quieter and more important than that. She got her mornings back. The same morning she had been giving to a chair and a window and a waiting feeling. She was kneeling in dirt at 7:30 a.m. with her hands deep in the earth, doing what she had always done, because her body finally had what it had always needed. Anytime you add minerals to your water practice, monitor your blood pressure at home. Not once a week, every morning at the same time, before coffee or medication. Write it down. 2 weeks of morning readings tells your doctor more about your blood pressure reality than 2 years of afternoon appointments. If you see a significant drop, more than 10 millimeters systolic, contact your doctor before continuing. Some people are highly responsive to mineral replenishment. That is a good thing, but it needs medical coordination with whatever medications you are already taking. The goal is not to replace medicine with water. The goal is to understand that your body has been asking for these minerals for years, that the symptoms you dismissed as aging are in many cases messages from depleted vessel walls and overworked kidneys, and that the distance between where you are and where you could feel is sometimes as small as 1 glass of water, 1 pinch of minerals, taken before the rest of the world wakes up.